A very good morning to respected officers, ANOs, staff, and warm greetings to you all, my dear participants. We are gleamed with joy and happiness to welcome you all for the fourth day of the 5-day national level online workshop on role of youth in nation building. We praise and thank all participants for the involvement shown during the past 3 days of this workshop. The topics were planned with the aim of addressing the role of youth in nation building. First day's topic communication skills and second day's lecture life skills have helped the participants to understand the need of improving themselves for the development of our nation. On third day, the beauty of national integration was discussed. Today, the whole world is locked due to COVID-19. Coronavirus has forced the human beings to practice a new normal lifestyle. Lakhs and lakhs of people in the world are suffering from COVID-19 and our nation is not exceptional. Taking this into account, it is essential for all of us to know about COVID-19. We have to create awareness among others about this pandemic to save our nation. Here we have a wonderful resource person, Sub-Lieutenant Dr. C. Binu Ramesh, Associate NCC Officer of Naval Wing, Tyagarajar College, Madurai. He will handle the session on health and sanitation during COVID-19 pandemic. This topic is very apt to today's scenario. Dr. Binu is working as Assistant Professor in Zoology in Tyagarajar College, Madurai. He has deep research sense and worked as JRF and CSR Senior Research Fellow. He attended 3-month advanced training in Hannover Veterinary University, Germany. He has received many awards. He is the recipient of DDG Commendation for Exceptional Contribution to NCC and received All India Best Cadet Award in NCC Pre-Commission course. He is very active and sincere in his duties. He has conquered the minds of cadets and fellow faculties by his approach and character. I am sure this session will be very enriching and useful to the participants. On behalf of 11th Tamil Nadu Battalion NCC Nagarkoil, Nesamani Memorial Christian College Marthandam and St. Saviour's Catholic College of Engineering Nagarkoil, I am extremely happy to welcome you, sir. Now I request you to address the participants. Please, sir. Thank you.
Jai Hind, cadets and friends. Welcome to the webinar on hygiene and sanitation during COVID-19 pandemic. I am Sub-Lieutenant C. Binu Ramesh, Associate NCC Officer, Sub-Unit 2 to Naval NCC, Tyagarajar College, Madurai. And today we are going to talk about the steps and precautions to be taken during COVID-19 pandemic and how to maintain the level of hygiene and sanitation during this pandemic state. So let's, I think everybody will be knowing that the COVID-19 pandemic state is not going to go as expected. So it is going to stay there for quite a long time now. As we can see, the spread is going out of control now. So now we are now bound to live with this pandemic, and we are bound to stay safe during this pandemic. And we are also forced to go out and do our daily duties also. So this lecture or this webinar will concentrate on how can we maintain a perfect personal hygiene and sanitation practices so that we can keep COVID-19 virus at a distance, and how we can help the government to get control of this pandemic state. As you know, that personal hygiene is something which involves practices performed by an individual to take care of one's bodily health and well-being through cleanliness. That is, these are practices which an individual performs at the individual level so that he can take care of all his health as well as well-being. And most importantly is that these health cleanliness practices will help him to prevent diseases from happening to himself, and it also deals with practices that maintains the person's health also. So very basic habits such as washing hands, taking bath, brushing your teeth, and all those things, very small things which you do as a morning routine, can help you in a long way to get rid of any illnesses, and it can keep all the illnesses or diseases at bay. And one important plus points of being in personal hygiene is that whenever you are maintaining a high level of personal hygiene, you feel very good about yourself, and also you feel confident, and you will not be hesitant to move around in the society. So that is the best thing out of personal hygiene. And as you know that one of the good qualities of a leader is to feel good about yourself and self-confident. So if you are going to take up a leadership role in any walks of life, you need to maintain a high level of personal hygiene. So this will help you to improve your leadership qualities as well. Again, sanitation is also refers to public health conditions, mainly in terms of keeping all your water related activities, especially how you to use your water, what levels of water usage, and how you are using, how you are trying to keep your surroundings neat and clean, and how and what are the methods you are adopting to dispose the waste which is generated due to human activities. So this will mainly come as a both hygiene and sanitation goes hand in hand, and you have to maintain a very good procedure, a very good level of hygiene and sanitation. And maintaining, if you are going to maintain your surroundings very neat and clean, doesn't mean that you clean your waste and put it in some other place. That doesn't matter. When you just get rid of the waste from your surroundings, doesn't mean that you are well sanitized. You have to make sure that whatever cleaning procedures you are doing or waste management you are doing does not affect others also. So that is also a sanitation practice which you have to take care of. The present situation where we have a high level of COVID positive cases around you, and what are the personal hygiene practices you need to take care while you are going to move around in the society, or you are to maintain to keep the COVID-19 at bay. As all of you know, washing your hands is the topmost hygiene practices at this hour, and not just washing simply using water. You have to use soap and water, and you have to scrub your hands for at least 20 seconds, so that, and make scrubbing practices. I think everybody will be knowing that we have a now standardized hand washing procedure, which is it's put up all over the places, and you know, both in social media it is, we know the hand washing procedures which are adopted. So I want every one of you to just have a look at it, so that you, whenever you wash your hands, make sure that you follow all the steps carefully, and a minimum time of 20 seconds is necessary to wipe off any viral load or viral particles which is sticking onto your hands. So, and another faster method of sanitation or hand sanitation is the use of hand sanitizers. Make sure that I think in the word of whenever this we use the word WhatsApp University, people are coming up with novel ways of bringing out homemade sanitizers, hand sanitizers, and everything. But the recommended procedure by both WHO and the Indian Council for Medical Research is that any sanitizer which is going to contain more than 70% alcohol is good enough. So make sure that whenever you buy any hand sanitizer or you make a homemade sanitizer, make sure that you have at least 70% alcohol content in it. This only will make sure that you have a perfect hand sanitizer and it's a reliable hand. And the second most personal hygiene practice, which is very hard to follow in this condition, which this is a practice which we do unconsciously, is that you should not touch your face, well, especially when you are out of your home, and if you are moving around in a societal place, say in a public place, on a street or anything, you have to make sure that you don't touch your face. And it has been calculated that within an hour we subconsciously touch our face nearly 23 times a day within an hour. So this is going to be very hard. So what we can do is that we either use a face mask, and putting on a face mask is going to make you conscious so that you don't touch your face. The other way is to put some sort of barrier in between the elbows. We were going to put some wristband or something like that in your elbows when you are going out. So whenever you try to reach out, bend your hands and reach out to your face, this wristband is going to tell you that you are making extra effort to touch your face, so that you will be conscious that you are not supposed to touch your face. This is a very easy procedure which you can adopt while going out. So make sure that you use some sort of a wristband at the elbow level, so that whenever you bend your hands, it is going to make your elbow tight. So when that tightness is felt on your screen, you will make sure that you will become conscious that you are about to touch your face. Then you can film. This is a very simple practice which you can follow during this pandemic situation. The other one is that we have to cover your coughs and sneezes. So whenever you cough or sneeze, it is necessary that you cover your mouth as well as your nose while sneezing. So what is the easiest way is that to use your elbow while you are sneezing and coughing, and if you are good enough, better have some tissue paper in your hand. And if you are having kind of since there's a time for rainy season and people do catch some common cold, so you can use a tissue paper to close your nose while sneezing, and it's better to use your elbow or upper arm to block, so that you don't spread any droplet infection to any other guys who is around you. So this is a very easy procedure which you can adopt, and also make sure that the tissue which you are using should be disposed properly. That is very important. The easy way is that you can have your own small plastic bag where you should keep all your disposed tissue. As soon as you reach your personal home, you can make sure that you burn it or bury it properly. So this would be a very good procedure. And most important fourth practice, personal hygiene practice, you need to follow is that you have to stay home if you are feeling sick, and look for appropriate medical guidance. So nowadays we have lots of helpline numbers available to help you and guide you whether you are having any symptoms which you think that this is going to be a coronavirus infection. So you can always, please, if you are going to have any symptoms which is recommended by the authorities, please stay home and don't try to come out of the home and you can call the any helpline numbers to get guidance. This is very important. Okay. Then the other thing is that there is an app which is called as an Arokya Setu app, which the government has recommended now. So you can also install this app so that you know that we are trying to go out of your home for buying some essentials for your needs, day-to-day needs. You can make sure that you can avoid certain areas where there will be containment zone, where there is a wide prevalence of COVID-19 patient. So you can avoid home, and also you can make sure that if you are going to handle symptoms, it gives you guidance whether you are have you acquired this COVID-19. So this app installation is also will be very useful for maintaining high level of personal hygiene. Practice which you have to maintain is practicing social distance. So both the World Health Organization and as well as the Indian Council for Medical Research is advocating at least a distance of 6 feet from each other if you are going to be outside, or if you are especially you have to this social distancing is very essential if you are going to work in a office setup where it is a closed room. So you have to maintain at least 6 feet or 2 meters from each other, so that if at all somebody is going to sneeze, you don't get affected. And if at all it is possible, you can make all your official works as well as even I would say personal meetings in a virtual mode, where we have lots of virtual tools where you can make all these meetings through a virtual mode, so that you don't get infection also, and you also don't spread infections. So this is very important that we try to make all these meetings as much virtual as possible, so that you don't harm other people also, and you also don't get harmed in this process. Then the other important thing is that whenever you are going to be in an, so you are made be in an office or an institution where you have to go in a cold closed setup, better not to hug or shake hands with people. So the traditional way of greeting, that is saying Vanakkam using a folded hand, is always the safest way to greet people when you are going around in the society. So it's better. I think you know that if at all you are going to see a very close friends after a long time, you are going to get a bit emotional and you are going to try to hug or shake hands. But for the safety of others as well as you, for yourself, better not to hug and shake hands. And a very important thing which nowadays people are not making a conscious effort is avoiding crowds. I think everybody needs essentials for their day-to-day living, and they need to buy essential items for their living. So whenever you are going out into the society in a place something like a market or a shop or any building, better make a conscious effort that if it is going to be crowded at that time when you go there, better come back and visit the same location maybe in later part of the day, so that you will maintain a social distance at that time, and also you don't get this particular infection. So better avoid crowds during as much as possible, and you can also make attempts to go in a later time. And if at all if you are going to go there also, you can use instead of taking up a public transport, you can always, if at all is possible, that you can walk to that particular location. That would be a very nice thing. Or even using a bicycle would be a better option rather than taking up a bus to that particular location. So this is very important when you are going to take it. Next misconception which is happening around is that to wear a mask. So everybody is wearing a mask, and this mask, as recommended by the WHO as well as ICMR, is that you need to wear a non-medical grade mask that is good enough. That will be a good enough thing. But make sure that you are using a non-medical grade mask, which is or a cloth which is thick enough, okay, it should be thick enough. Don't use something like a very silky ones. Try to use something mask which is made of cotton material. That will be much more effective. And they say that just to give you an idea what sort of cloth is good enough, they say that if you are going to use a tablecloth is some much thicker, something like which will be equal to your the towel, cotton towel which you are using to wipe yourself. If you are going to make a mask of that kind, maybe 2 layers of that particular cotton material, that is good enough. This mask is just to prevent, if say for example, if you are infected or if you are an asymptomatic COVID patient, you will not, if you are going to sneeze or cough, this cough droplet will not travel into the air so that it affects the other. So this is the basic need, and there is no need for any specialized mask, say for example surgical mask or N95 mask. But these masks are required by people who are going to give care to the COVID-19 patients. Say for example somebody who is attending a COVID-19 patient, he needs a surgical mask. And especially people who are in the medical side, who are there with the treating people, then they need to wear an N95 mask. But there is no need for people to buy these surgical masks and N95 masks to go around inside doing public places. So this is always another thing. And one misconception which is there going on is that while wearing a mask, you might feel depletion of oxygen. People have shown in social media also where they say that while you are wearing mask, your respiration or your oxygen level or oxygen saturation level in your body will not come down. It is perfectly maintained at 100%. So don't think that while if you are going to wear a mask, your oxygen intake is going to go down. No way, and no, this is not happening, and this has been proved using you can use log in for if you are looking into going to look into the social media, you can have quite a lot of videos which show that while you are wearing mask, your oxygen levels or your oxygen saturation levels in your blood perfectly maintains at 99 or 100%. But if you are going to wear this mask and do some heavy exercise or heavy workouts, then you may experience some physical discomfort. But that is again is not going to bring down your oxygen saturation level. And one important thing while wearing a mask is that if you are going to wear a mask, something like a surgical mask or a cloth mask or even an N95 mask, you should know how to disinfect it properly. So I will go one by one. Say for example, if you are using a reusable cloth mask, then the best way would be to, once you wear it, to just soak it in a solution of Dettol for at least 1 hour so that it perfectly gets disinfected. Then you can use your normal washing soap to wash the cloth and reuse it. Surgical mask, you can't reuse it. Once you're going to use it, you have to throw it away. So here comes the important part, that you should dispose it properly, or if you are going to collect it or put it in a place where it is going to be incinerated or it is going to be burned, that would be the right thing. And as far as N95 masks are concerned, you can reuse it, but for reusing you have to at least dry the mask for at least 48 hours. That is 2 days you have to keep it dry so that it is perfectly dry and you can reuse it. Or people even recommend using it or drying it for at least 3 days, that is 72 hours, so that it can be reused. So all these procedures has to be followed, and most important thing is that if you are going to use a surgical mask or which is use and throw mask, make sure that you are disposing it properly. There are cases where 4 people have taken this mask and they have reused it and they have caught up with this COVID-19 infection. So please make sure that you don't destroy the environment by using excessive amounts of mask, which is disposable mask. And we come to the last part, which is keeping your surfaces clean. Is also a very good, it's a part of the sanitation practice. So we tend usually, if you are going, say for example, if you are taking a bag, you will be taking your personal belongings, something like your bag, your purse, your credit cards, your ATM cards, and all those things while going out and using it for purchasing and all those stuff. So once you come back into your home, you have to make sure that you disinfect all these items. So what is the recommended is that again you can use a normal sanitizing solution which has 70% alcohol, and you can take that sanitizer in a tissue paper and wipe your mobile phones, ATM cards, debit cards and purses perfectly and keep it separate. One thing which people do quite often or in a wrong way is that once they wipe it, they tend to make it dry with the next cloth. So that once they wipe it with the sanitizing solution, then they feel that it is wet. So now they take up a dry cloth and just wipe the wet part, which should not be done. This any solution which is a sanitizing solution, you have to leave it to dry by itself. You should not go and dry it using a separate cloth. So this has to stay. This solution has to stay on there and get it dried by itself. You should not try to dry it by wiping it with a dry cloth. So this is important. And you have to look for surfaces where people will be using quite often. Say for example, door handles, your phones, your remote control. Say for example, some of your friends came in and they were using a remote control, light switches, bathroom fixtures. These are places where, say for example, you are in an office and you are going to monitor this cleaning activity. Make sure that the people who are cleaning the office premises, make sure that they have clean these areas which are very essential. And you can also take extra care while you are using your ATM machines. And nowadays all these ATM machines have the sanitizer, so don't feel lazy to use those sanitizers while using it. Even though now people have said that the viral load in this structure, say something like an ATM or a credit card, is going to be very low to cause an infection, better be careful. So that you practice extra precautions while doing it. So always be extra careful while using this. And sometimes if we are going to due to unavoidable situations, we have to go to visit eating common public eating place, something like a hotel, to get a packed food or anything. Also make sure that you don't touch all those surfaces. Try to avoid all those surfaces so that you don't because people nowadays it is, since the pandemic is widespread now and it is taking a wide thing, it is better not to touch all those surfaces and try to minimize. And one wrong thing which people do is that they try to wear a glove while going out. It's good to wear gloves, that's no problem. But if I would recommend that if you're going to wear a gloves and if you're going to a specific place and if you're going to come back maybe within a span of 1 hour, or then I would recommend you can use a gloves. But if you're going to wear those gloves all throughout the day and if you're going to multiple places, then you would be called as a super spreader, where you will be carrying out all this, you will be touching all the surfaces using this gloves, and the gloves will be a carrier of this virus and you will be spreading it to all places. So I would personally not recommend wearing a gloves if you are going to go to multiple places and you are going to interact with people or interact with surfaces there. So then you would be a cause for spreading all those viruses. So I would not recommend wearing a gloves if you are going to go to multiple places. Yes, if you are going to one place and going to return back, and if you think that there is a risk that you have to touch the surfaces there, and that I would recommend can wear a gloves. Otherwise, better not to wear a gloves. And important thing is that if you are going to wear a gloves, again dispose it in a safe manner. So many a times people use, I have seen people using cloth gloves. I don't think cloth gloves is going to protect you in a big way, because cloth gloves, when they get wet, accidentally or something, it is going to allow the virus particle to get inside the get onto your body surface. So wearing a cloth gloves is not going to help you in any way. So you can wear an alternative surgical gloves or a plastic gloves, that would be fine. But once you use it, it is better to dispose it in a safe manner, either burning or burying it deep, so that you don't cause infection to others. And yet another thing is that if you are going to use the gloves also, make sure that you know the right procedure to how to remove it properly after usage. That is also very important. The other thing is that if you're using wet or cloth gloves, better use a sanitizer or a washing solution to wash your hands even after the usage, so that you are safe enough. So wearing gloves is a good practice if you are going to a single place, and make sure that you know how to dispose the gloves properly, and also make sure that you clean your hands after the usage of gloves as well, so that you'll be double sure that there is no virus particles in your hand. So always use a disinfectant which is good enough, which has a proven cleansing and disinfection activity. Don't use any homemade disinfectant which you don't know the efficacy. Again, the WhatsApp University is providing you with quite a number of homemade disinfectants. Yes, I am sure that all those natural materials which are used in it has some disinfecting properties, but you can't be sure that while preparing that disinfectant solution, or while using that solution, you have to be 100% sure that it's actually disinfecting. So we can't make sure that this is actually 100% effective. So it is better to buy products which are certified. Say for example, using a basic bleaching powder. Bleaching powder is very good. It has a very good bleach thing. You can use that. There is also commercially available bleach solutions also. We can use this diluted bleach solutions for disinfecting surface. That is also fine. And what yet another, say for example, if you are going potassium permanganate is also a good disinfectant solution. Say for example, it can be used for places where if you want to cleanse the feet of the person, especially the feet region, then you can just pour some amount of diluted potassium permanganate or bleach onto a sponge or big sponge thing, and you can just pour that, so that people who, when they enter, they just need to stand on this sponge, bleach drenched sponge, for at least 5 or 10 seconds, and they can enter, so that they feel disinfected. So these are which you need to carry your hygiene and sanitation practices, which you need to follow strictly in order to keep away the COVID-19 infection. I hope all this information which I shared with you was useful, and maybe we'll meet at another opportunity. Thank you.